This video is for informational purposes only, and the information presented in this video is not to be used for medical advice or diagnosis. Also, keep in mind that where you feel a pulse on one person might not be the same exact spot that you feel it on another person, and it may feel different depending on who you're practicing on. A pulse grade of 0 means that the pulse is absent. A grade of 1+ means that the pulse is weak or thready. A grade of 2+ means that the pulse is normal. And a grade of 3+ means that the pulse is full or bounding.
Okay, so we're going to find the radial pulse, and the way we're going to find this is I'm going to use 2 fingers, and I'm going to find her radial styloid process while her hand is supinated or palm turned up, and then I'm just going to palpate until I hear or feel a pulse. And then I would grade it as a 2+ because it's normal.
Okay, so we're going to be finding the brachial pulse. This pulse is located on the middle of your arm, right there where you see that crease. So on Katie, that would be right here. You can also ask your patient to make a bicep. So if Katie makes a bicep, her bicep's right here. And I'm going to go just medial or on the inside of that bicep, and I'm going to palpate right here. And I feel her pulse right there. And I would grade that as a 2+, which is normal.
So we're going to find the carotid pulse, and the way you do this is we're going to find her sternocleidomastoid muscle and her mandibular angle, and we're kind of going to go right between them. So can you look this way for me? Okay, so here's her mandibular angle, here's her sternocleidomastoid muscle, go right between them, and that would be where her carotid pulse is. And I would grade that as a 2+.
Alright, starting with the lower extremity or the leg, we're going to go distal to proximal or foot to hip, and we're going to start with the dorsalis pedal pulse. Katie, can you bring your big toe up towards you? Awesome. I'm going to look for that tendon and go more closer to her little toe with it. I'm going to feel for that pulse with 2 fingers again, and I would grade that at a 2+ or normal. Okay, so next we're going to be palpating the posterior tibialis pulse. To do that, we're going to find the ankle bone on the inside of your foot, and then we're going to go slightly posterior to that or backwards from it, and we're going to feel with 2 fingers, and there it is, and I would grade that as a 2+ or normal.
So what we're looking for now is the popliteal artery or popliteal pulse. So this is an artery that runs behind the back of the knee or in the popliteal fossa. So what you're going to do is you're going to come behind the knee and you're going to feel for the 2 heads of the gastroc or the calf muscle, and then you're going to come up and try to take as much space up as you possibly can, because this pulse can be kind of faint, and really try to wait and feel for that pulse. All right, and I would give Katie a 1+. Next, we're going to find the femoral artery. So this is an artery that runs down into the thigh. So what we're doing today is usually you would find it directly on the skin, but today we're going to do it over clothing for this video. So first what you want to do is find the patient's ASIS, or the bony point on their hip. So that's what I'm going to do with Katie first. Then you want to find their pubic tubercle. I'm going to have the patient do this. So do you mind searching for a bony prominence in your pelvic region for me? Okay, great. Then you're going to come midline between these 2 points, and you're going to line up about in the inguinal crease or crease of the thigh, and then you're just going to feel or palpate for the artery. Okay, and so I would say Katie has about a 1+.